Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Uh, Angioid streaks. What are angioid streaks? They are crack-like dehiscences which are present in collagen and the elastic portions of Brech's membrane. In the collagen and elastic portions of Brech's membrane, we see these angioid streaks. These are actually secondary changes which are seen in retinal pigment epithelium and also choriocapillaries. So these are the angioid streaks which are available in which are seen. These are crack like dehiscences which are seen in collagenous and elastic epithelium of Bruch's stroma. This angioid streaks is actually, it is of two types. One, it can be either idiopathic type of angioid streaks, or it can be associated with certain diseases. Like this can be associated with pseudoxanthoma elasticum, Paget's disease, Ehlers-Danlos syndrome, sickle cell anemia, and incontinentia pigmenti. So these angioid streaks are associated with pseudoxanthoma elasticum, Paget's disease, Ehlers-Danlos syndrome, sickle cell anemia, and incontinentia pigmenti.
thank you and thank you for watching.